Have you been experiencing sensitivity to your teeth when you're taking hot and cold things, or a bit of pain, discomfort when you are eating, when you are chewing? Then there is a possibility that you might be having cavities. When you have cavities in your mouth, these are some of the symptoms that normally you would experience. Like I'd already mentioned, you may have a bit of sensitivity when you take cold things or even hot things. When you're chewing food with the back teeth, you may notice you are feeling a little discomfort. That's an indication that one of your teeth or several of your teeth most likely have some cavities. Or when you're brushing your teeth, when you open your mouth, you notice dark discoloration or brown discoloration on the surfaces of the teeth or on the front teeth. In between the teeth, you notice some darkness, then usually that is an indication and you need to get some help. When it comes to cavities, basically at home, there is not so much, because what happens with cavities is that by the time the tooth gets that cavity, there was a bit of sugar and food remaining on the teeth, and then you have the bacteria that are in the mouth. They use that sugar and then they convert it into an acid. Then that acid breaks the enamel, the white covering coating of the tooth. That's how the cavity ends up forming on your teeth. Of course, there will be several stages of the cavity. During the very initial stages, you might not experience anything. But as the cavity progresses from enamel to dentine, that is when you start experiencing some sensitivity, a bit of discomfort, and what have you. So at that point, there is probably very little you would be able to do at home. Of course, we encourage you to brush, use a fluoride toothpaste, but eventually you definitely need to go and see your dentist, because then something needs to be done. That process needs to be arrested by cleaning out the decay, cleaning the cavity, and putting in a filling. These days, we are basically using what we call composite fillings or resin fillings to fill those cavities. This is a tooth-colored filling, so it matches with the natural color of your tooth, so that later on, even if you open your mouth, you may not even see where that filling was done. Initially, those early days, we were using the old silver or dark amalgam fillings. Over time, we have come to phase those ones out because of concerns, because there is mercury in amalgam. So we are not even using it, especially in our practice at Tender Care. We are not using that anymore. We are using basically composite fillings. We use also inlays to fill in those cavities. And in very severe cases, we might end up doing a crown on that particular tooth. So if you have any of those symptoms that I have mentioned, a bit of sensitivity, discomfort to chewing, notice a bit of discoloration of your teeth, we would welcome you to come to Tender Care Dental. Make a telephone call. Our phone numbers are on this video. We will help you. When you come, we will do a checkup initially. We will take some x-rays to just see the extent of the decay. And then from there, we shall discuss with you how do we go about the treatment. We make a treatment plan, and then we agree what is the cost, what is the timelines, and you'll love the journey, because we want to help you keep your teeth for a lifetime.